Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Taraba State government asked the federal government to declare red alert status on all states across the federation for effective fight against the spread of the Delta variant. Edo State government asked Nigerians to celebrate responsibly and with minimal contact to avoid infections. And France moves to tackle fourth wave of coronavirus infections as Prime Minister Jean Castex pronounces the Delta variant as the dominant strain in the country. The World Health Organization, WHO, has said that the success of the Tokyo Olympic will depend on how infections are handled. Dr. Tedros Adhanom Ghebreyesus was speaking at a meeting of the International Olympic Committee in Tokyo. According to him, the right plan should be put in place, making sure that any cases are identified, isolated, traced, and cared for as quickly as possible, and onward transmission is interrupted. Meanwhile, the Nigeria Center for Disease Control (NCDC) says 206 cases of COVID-19 were reported last night in 9 states and the Federal Capital Territory. According to the agency, Lagos topped the list of infections with over 100 cases, but no death was reported. Let's take a look at the report.
The Nigeria Center for Disease Control is urging everyone to put physical distance between themselves and others to help avoid contact with respiratory droplets when a person infected with COVID-19 coughs, sneezes, or talks. Keeping a distance of at least 2 meters from anyone showing symptoms of respiratory illness may be the distance between you and a COVID-19 infection. The NCDC is reporting 206 new infections of COVID-19 from 9 states and the FCT in the last 24 hours. This is 71% higher than the 146 cases recorded in the previous 24-hour cycle. Lagos, as usual, had the highest numbers with 132. Akwa Ibom recorded 56 cases. Ekiti had 5. 3 cases were reported from Delta, while Rivers, Enugu, Jigawa, and Katsina had 2 cases each. Gombe and the FCT recorded 1 case each. Plateau, Sokoto, Kano, Oyo, Ondo, Osun, Nasarawa, and Kaduna states did not report any cases. Nigeria now has a total of 169,884 confirmed cases. 23 people have been discharged in the last 24 hours, raising the total number of recoveries to 164,733. There has been no death from COVID-19 related causes, keeping the fatality toll at 2,128. The number of people on admission around the country has jumped to 3,013, while over 2.4 million samples have been tested so far. In Africa, there are over 6.2 million confirmed cases and more than 159,000 deaths on the continent. Globally, more than 191 million COVID-19 cases have been confirmed, while deaths have surpassed 4 million.
Well, the Primary Healthcare Development Agency in Taraba State is describing an emerging danger of the inability of the Nigeria Center for Disease Control to raise alarm across the country on the possibility of the Delta variant having devastating effect. According to the agency, placing states on red alerts does not in any way douse tension without lockdown or restriction on interstate movements across the country. At a briefing in Jalingo, the state capital, the executive secretary urged residents to continuously practice the non-pharmaceutical measures against the pandemic. On the scarcity of the COVID-19 vaccines, he asked residents not to panic as government is doing everything possible to get more vaccines.
Yes, the Delta variant is now in Nigeria. There are states that have been tagged as danger zones. Abuja, Kano, Katsina, Benue, and other states, almost 6 states that are areas that of concern. But I want to believe all other states are also areas of concern because 8 of the 6 states are neighboring other states, and all other states are neighboring other states. So all we need to do as individuals and as people is to ensure that we continue maintaining the non-pharmaceutical approach to the coronavirus. It is just very simple: use of face masks, use of hand sanitizers where available, then use of soap and water to wash your hand, then social distancing. If we are able to achieve that, definitely it will go a long way in bringing down the number of cases that we have been seeing.
Over in Edo State, the government has called for caution against disregarding the COVID-19 preventive guidelines during this year's Salah celebrations, particularly in the wake of the potential third wave of the virus in the country. The Permanent Secretary, Edo State Ministry of Health, who delivered an address on behalf of the state government, said the spread of the deadly Delta variant, which has already been discovered in the country, can be curtailed if proper precaution is taken across the country.
As we go about the celebration, we must bear in mind that COVID-19 pandemic is not yet over. I urge you to be cautious and protect yourselves by adhering to the public health and safety measures against the spread of coronavirus disease in the wake of the third wave of this pandemic. The Delta variant of this virus has been detected in Nigeria, though no case has been confirmed in Edo State, which makes it even more imperative for us to be cautious and prevent the highly transmissible Delta variant from gaining entrance into Edo State. As we travel to and fro.
Meanwhile, health experts in Yobe State have again stressed on the need for residents to accept the COVID-19 vaccine, saying once the residents are protected, the economy would improve. Program manager of Yobe State Saving 1 Million Lives program, Dr. Babagana Abba, called on residents to take advantage of the vaccines when they become available by government to prevent infection.
From for improving the immunity and protecting the lives, of course, is also protecting the economy of the nation. They're protecting of the nation because once vaccination being provided, most people now, the chances of them to contract the disease, to get falling sick, is very less. So it will prevent people to go to school, go to work, go to do this now, because with this now continuously, I think the economy of the country, of the community, will continuously be sustained without having any issue of recession or etc. But with this now, it makes the people and the community and the society much more happier and healthier to move around to do their one or two activities. And of course, then it protects the government from spending a lot. Because once the disease is become, the incidence has increased, the prevalence are very, very high. The government now will engage, divert the priority from the other sector of the populace to the health sector. While they keep buying the drugs, keep buying the medical consumables, keep constructing hospitals, etc. Of course, keep feeding the ill patients. Now the priority of government has already shifted. Now as a result now of the government will going to cost the government a lot. All other sectors of basic amenity they suffer a lot because of the health critical issue have already affected the government sectors.
And to preventing a third wave, we have joining us Dr. Alera Roberts, a public health physician. She joins us via Zoom. Thank you for joining us on the program.
Thank you very much for having me. How are you?
Very well, thanks. Now, the Presidential Steering Committee warned that states of the Federation should heighten their, state of preparedness and continue to enforce all protocols put in place, given the renewed greater ease, or rather the spread of the Delta variant. Looking at the cases we've been recording, I know Lagos over 100, but in the other states and those cases, is it an early sign of perhaps increase or a sort of third wave, would you call it?
Very definitely, it is the beginning of a third wave. And what we want to prevent is we want to prevent a really high spike of cases. There's an uptick. And if we can level it out now and even get it down, that is the aim of the game. In Lagos State, we have always been the epicenter of this disease. And the last thing we need for our commercial activity's sake is a large number of cases that just take off in the community.
So looking at Taraba, which we just played, the Primary Healthcare Development Agency Executive Secretary saying that, NCDC's alarm isn't loud enough. There's still interstate movement across the country. There's also the threat of the highly transmissible Delta variant. Now, shouldn't we have red alert on all states of the Federation rather than those 6 and the FCT?
Well, thankfully, that's not a decision I have to take, and it is not advice I need to give anybody because that's above my pay grade. But the bottom line is this. He did say something that was very critical and very crucial. Mask up, hand wash, space out. I keep saying that I'm not talking to government because government has really done everything it needs to do based on the science that we have, based on the resources that we have. It is up to us as a people to obey, to just decide that we don't want to be victims of this really vicious, nasty disease, and we will just decide to do the right thing. Somebody had said it earlier in the week that the problem with this disease is that people do not really see its effects, because the people who get the disease and get sick are getting sick and dying alone. Family is not there to see how much they suffer. But what we do see and what we keep warning people against is that God forbid you have a loved one who gets really sick with this horrible disease and ends up in hospital. The family is running helter-skelter, looking for money, looking for oxygen, looking for this, that, and the other. And eventually, the person goes and dies. That's a huge, devastating blow. It is at that time that the family suddenly realizes that, hey, this thing is real. And what I'm begging everybody, don't let it be your family. It doesn't have to be you. Accept that this is a nasty disease. It is real. It is running havoc in the country. And we have very simple, easy to obey solutions to prevent it wreaking havoc amongst you and your loved ones. Mask up, hand wash, space out.
Taking a look at some data, especially coming from the NCDC, I picked out about 10 states, Lagos, the FCT, Rivers, Oyo, Kano, Kaduna. Now, looking at some of the states on red alert, you'd see that for example, Lagos yesterday had on admission 2,285 cases. And as at today, so Monday into Tuesday, you have 2,417. So that has sort of doubled. The FCT had just one extra on admission. Rivers actually reduced, or you're reduced as well. States like Kano and Kaduna just have 3 to 4 cases on admission individually. But when we look at Akwa Ibom, which is not on the red list states, yesterday it had 54 cases that it is managing, and talking about Monday, and now as at Tuesday, and which we can see today, it's 110 cases. So essentially, the numbers there have doubled. What do you think could be happening, especially in Akwa Ibom, and seeing it's also not on the red list states?
It's very simple. Carelessness and complacency. People are no longer taking it seriously. People are going out, they're going to parties, large funeral gatherings, they're gathering together to watch football, they are crowding themselves into religious places of worship. People are just being complacent and careless. And look at the numbers are going up. And whether you like it or not, one death is a disaster. One death is a disaster, because nobody suffers a loss of a loved one and starts saying, well, thank God it was only that loved one. Nobody does that. And this is a disease that we don't have any other protection. There's no magic bullet. There's no cure. All we have is prevention. And the major prevention that we have, the vaccination, we are still waiting for. So the next best thing we can do is to mask up, hand wash, and space out.
Indeed, the non-pharmaceutical interventions. We'd like to thank you. Always a pleasure having you on the program, Dr. Alera Roberts, public health physician.
Thank you for having me.
We have more on the program when we return. Please stay with us. Welcome back. In Poland, Central Europe, there have been over 2.8 million coronavirus infections reported and over 75,000 deaths in the country since the pandemic began. As at today, one infection per 100,000 people are reported in the last 7 days. Its vaccination tracker shows over 33 million doses of vaccines have been administered. And assuming that each person needs 2 doses, that's enough to have vaccinated about 43.6% of the country's population. Dr. Michał Matyjasek, family medicine specialist, joins us from Łódź, Poland. Thank you for joining us on the program.
Thanks very much for inviting me to the program.
All right, so do we know ultimately how many people have been fully vaccinated in Poland?
At that particular point, it's about 16 million people that have been fully vaccinated, and another 2 million is after 1 dosage.
So the country seems to be doing well, reporting an average of about almost 200,000 doses administered daily. How would you assess, the efforts of governments and the vaccination drive?
At that point, we are starting to drop on the number of vaccinations done daily because most of the people who wanted to be vaccinated themselves. And at that point, the government is doing whatever they can to actually start another groups to the vaccines, because now we are by the wall with the number of people. We have vaccines, we don't have people who want to be vaccinated. So that's starting to be an issue because we are still under the number that we need to have population response.
Talking about herd immunity. But when you talk about people who do not want to be vaccinated, that's essentially vaccine hesitancy. What are they saying?
Mainly, some of them are afraid. Some of them think that the whole pandemic thing is over, and it's wholly untrue. The problem is that at that particular moment, we have about 100, 120 cases a day, which is a very low number comparing to 32,000 in the on the wave of COVID. But now it's starting to grow. Now slowly, but it's starting to be similar to the situation that started in England and Israel. So in a way, we need to teach people and help them to understand that the pandemic is not over. And if you go on the street in Poland now, in open spaces, we can stop using masks for past month or so, and people tend not to use them in close background as well. So in shops, in malls, and that starting to be very, very frightening for people who know something about the pandemic.
So essentially fatigue setting in, but then government should be redoubling its efforts to continue with the education and the sensitization.
Exactly. And a lot of people want to vaccinate also younger children. That's another group that cannot be vaccinated by now. Now we are vaccinating children over 12 years old. There is a huge problem with vaccinating younger children because there is not enough evidence, not enough scientific evidence that the vaccine is fully safe. And another issue is that we are now in holiday season in Poland and children are not going to schools. So it's not that easy to get to the younger population between 12 and 18. For the government, now they are trying to use, let's say, a carrot, not to use the stick, so not to force for the vaccinations, but in opinion of most of the influential doctors in Poland, we need to start thinking about forcing people to vaccinate, to go to cinema, to go to theater, to go to concerts, only for vaccine people. That's the only solution that started to occur in past month or so. I know that similar decisions are made in France, similar decisions are made in Italy in past week, I think, and that's the solution. It's not a good solution from the point of view of let's say people freedom, but it's a good solution from the point of view of medical situation.
Dr. Matti Iesek, in terms of restrictions that are in place, like schools, workplaces, and even the international borders, what are they to controlling the virus?
For now, according to regulations in Poland, if you are going back from a non-Schengen country, you have to stay for 10 to 14 days quarantine. But apart of that, there is not too many issues. If you are vaccinated, if you had COVID in past 6 months, or you have a test that says that you are not sick, and that is for 48 hours, valid for 48 hours. So for those people, the borders are open. For rest of the population, there are huge restrictions in going even through Europe, not only to Poland.
Okay, so even if you're going to a restaurant, are there signs that you have to wear a mask or you have to be vaccinated? Some of the similar cases we're seeing in places like the UK?
For now, there is a lot of signs for that you have to keep the distance of 2 meters, keep the masks on if you are not consuming your meals. But people tend to ignore them. And the worst part is that the owners of the restaurants, owners of the shops, owners of cinemas are not actually putting those as a problem. They are not seeing that as a problem. They want to get back on track with earning money. And if they will be too strict, they will lose customers. So there is a problem with that. And government is not forcing even existing regulations on people. That's a problem.
So some of the challenges coming up with the pandemic in Poland. We want to thank you so much, Dr. Michael Matiasek, family medicine specialist in Łódź, Poland. Thank you for joining us on the program.
Thank you very much for inviting. Thanks.
Stay safe. Now, the total number of confirmed coronavirus cases around the world is nearing 200 million, according to data from Johns Hopkins Coronavirus Resource Center, with the US still leading the world with the highest number of cases, followed by India, Brazil, Russia, and France. Almost 4 billion vaccine doses have been administered, most of them in China, India, and the US. Let's take a look at the global update.
We begin in France, where Prime Minister Jean Castex says the Delta variant of the coronavirus is now the majority variant circulating in the country. He says major steps taken to tackle the fourth wave of infections in the country have been settled upon by a cabinet meeting of the government. The French government has begun to present lawmakers this week with a new plan to fight COVID-19, which will include a health pass in a wide array of venues from the start of August and making vaccination mandatory for health workers. Spain is allowing pharmacies within the country to sell antigen tests without any kind of prescription as from Thursday, July 22nd, in a new effort to curb the increase of infections across the country. The government approved the sale of antigen tests on Tuesday as the country's regions consider further restrictions to curb the rise in COVID-19 cases. The sale will become official from Thursday, a day after the publication of the decree in the official state gazette. The Indonesian government has decided to extend the emergency community activity restrictions, known locally as PPKM Darurat, to July 25th, as the country is still fighting the second wave of COVID-19. During a virtual press conference, President Joko Widodo said the government had decided to extend the policy for a week and would relax it on July 26th if cases drop. Finally, Australia's two largest states have reported a sharp increase in new COVID-19 cases today, a blow to hopes that lockdown restrictions would be lifted with more than half the country's population under stay-at-home orders. New South Wales State, home to the country's most populous city, Sydney, logged 110 new cases, up from 78 the day before, nearly 4 weeks into a lockdown of the city and surrounding areas to contain an outbreak of the virulent Delta variant. Victoria State clocked 22 new cases, from 9 the day before, its biggest increase since the outbreak began this month, as it nears its second week of statewide lockdown.
Let's continue to take and celebrate responsibly, adhere to the safety measures, and we have more updates on our website. You can find the latest, and that's breaking news stories, and also the latest on the coronavirus pandemic. You can see hundreds of Ugandans given fake COVID-19 jabs. Health officials are saying that you can indeed follow all of the stories at channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Mwaka. Stay safe.